Good afternoon, guys. I have discussion B for you. We're discussing new laws on chemical restraints in nursing homes. So that is today's discussion B for you. So let's get into the discussion, shall we? Okay, the line linked in home insights new laws on physical and chemical restraints in nursing homes, health law, legislation, and dispute resolution is a breadcrumb navigation header. It situates the article within the website's structure, part of the insights section written by a law firm and categorized under health law and legislation and dispute resolution. This signals to readers that the piece is not just informational but also professional legal analysis. Purpose of the page. The page is a commentary by Arlington's lawyers on the quality of care amended, minimizing the use of restraints principles in 2019, a federal regulation in Australia. The law was introduced to curb inappropriate use of restraints in aged care facilities, reflecting growing public concern about elder rights, dignity, and safety. The article explains how the law distinguishes between physical restraints, devices or actions that restrict movement, and chemical restraints, medication used to control behavior rather than treat illness, and explores the legal and ethical implications for nursing homes. Key points about physical restraints. Definition: any device, action, or practice that restricts a resident's free movement. Conditions for use: only when there is a risk of harm to the resident or others. Alternatives must be attempted first. The restraint must be at least the restraint must be the least restrictive option available. Informed consent must be obtained from the resident or their legal representative. Documentation must be recorded, monitored, and reviewed. Emergency use permitted but must be temporary, justified, and documented. This framework reflects a strong emphasis on resident autonomy and safety, aligning with international human rights and standards. Key points about chemical restraints. Definition: medication administered to influence behavior or restrict movement, not for treating medical or psychiatric conditions. Conditions for use: must be prescribed by a doctor or nurse practitioner after assessment. Documentation of the decision and rational is required. The residents the residents' representative must be informed. Ongoing monitoring of the residents' response is mandated. Unlike physical restraints, chemical restraints do not require proof that alternatives were tried first, nor do they require uh, demonstration that the restraint is a last resort. This creates a regulatory imbalance that the article critiques. Concerns and legal implications. The commentary highlights several issues. Stricter safeguards for physical restraints. Compared to chemical restraints, may unintentionally encourage reliance on medication. Consent remains critical. The law does not override existing requirements under state and territory legislation. Medications still generally require informed consent or lawful substituted decision making. Risk of misuse. Without explicit requirements to exhaust alternatives, chemical restraints could be used as a convenience. Measure rather than a therapeutic necessity. Litigation potential. Families or advocates may challenge nursing homes if chemical restraints are used without proper consent or documentation, raising liability risk. Why the breadcrumb matters. for readers. The breadcrumb is more than a navigation tool, it signals the audience and purpose of the article. Readers can immediately see that this is a law firm insight piece, not a government directive targeted at healthcare providers, aged care administrators, lawyers, and families navigating elder care regulations, positioned within broader themes of health law and disputes resolution, meaning the analysis is both explanatory, what the law says, and evaluative, what gaps and risks exist. Broader context. The article sits within a large debate about elder rights and aged care reform. Globally, there is increasing scrutiny of restraint practices in nursing homes, with advocates pushing for greater transparency and reporting, stronger safeguards against over medication, policies that prioritize dignity, autonomy, and person centered care. By situating the discussion in the insights section, it the firm is contributing to the debate, offering legal interpretation and warning stockholders about areas where compliance may be contested. Hey guys, that's your B for this afternoon. I'm going to take a little break and then I'll be back on with C shortly. For now, Gator Wellness. Take care, folks. I'll be back on shortly with C.